States scrambling to increase the number of people receiving the COVID-19 vaccines. At midweek, the federal government had distributed more than 17 million doses of vaccine, far below their stated goal of 20 million by January 1st. And roughly 5.3 million people had actually received their first shots. Our question is Oklahoma doing better than other states in inoculating the citizens who want it? Rory Taylor has our report as phase 2 of distribution is now underway.
We have an appointment set for every single dose we have currently in Oklahoma.
The Oklahoma Health Department reports having received 174,900 total doses of the Pfizer and Moderna vaccines. Of those, less than a third have been administered, but the state is entering phase 2 of vaccine rollouts this week, which is expected to help with that.
Up to this point, it's been a little slower. It's kind of to be expected when you are dealing with specific populations. And again, now that we're able to open it up to broader groups, we can create the type of environment we need in order to move through vaccine very quickly.
Phase 2 of vaccinations is a broad one, and the state is starting with just a slice of it. First responders, an expanded group of healthcare workers, and where supplies allow, those 65 and older.
Last week, we announced that we are establishing pods. These are point of distribution sites across the state in coordination with local partners and county health departments. These are to increase our access points for vaccine throughout the state.
They are coordinated with local communities, led by the local county health departments. They probably will not be held at a county health department. They'll be held at other sites that are capable of handling larger groups of people. So with that, this kind of marks our transition into a higher throughput model.
This week, the state launched an online vaccine registration portal at vaccinate.oklahoma.gov, which allows all Oklahomans to register for vaccination.
If somebody goes in and registers at this point, they will go in, they'll start with their demographics, they will enter their screening information, and once they do that, they will be notified that they are registered.
Once registered, whether you're in phase 1 or phase 4, you'll receive a message that you can log on and seek an appointment once the vaccine is available for your group.
Once we identified that we were ready to move with these larger throughput, larger volume clinics, we didn't want to leave vaccine in the freezer. We don't want to put it into people's arms. The State Department of Health is also increasing their staffing for 211 calls to help people who don't have access to the internet. But in Oklahoma, somewhere around 10% of our population is under a tribal healthcare department rather than the state's. Sean Terry, the Secretary of Health for the Muskogee Creek Nation, says they have already started distribution beyond healthcare workers.
The next week we got the Moderna. We started working on the frontline workers with the rest of the tribe, like our food service workers and child care workers and so forth. And then also started working on Tier 2 of the elderly population and some of those as well.
There's been some fluidity in the state's distribution as well as in the tribe's tiers of distribution, due in part to fluctuating supply and scheduling difficulty.
We started with the oldest and are working our way down to the youngest. And so that's kind of what we're working on from a list standpoint. You can also go to the Muskogee Creek Nation Department of Health website. And on the upper left corner there, you can click on the vaccine information, and it gives you a number to call.
The CDC's magic number for a population to gain herd immunity is at least 70% inoculation. But many people are still hesitant to get the vaccine. Public affairs firm Amber Integrated took a look at where Oklahomans stand.
It's a little concerning that we don't quite have 70% of Oklahomans wanting to get a vaccine. Currently, in a survey that we did in December, 65% of Oklahomans indicate that they are willing to get a vaccine, and that is up since before the election, where we actually had a minority of people saying that they were interested in getting a vaccine. So it's a good trend to have, but it's certainly not the overwhelming majority that we'd like to see at this point.
The data shows that the most vulnerable demographics, primarily the elderly population, are most willing to get the vaccine, while younger people are less likely to get vaccinated.
Among those groups and among all groups that are hesitant about taking the vaccine, they are most worried about side effects and the efficacy, the how the vaccine will, how effective it is. And so as more information becomes public about this vaccine, we should see those numbers improve among those populations.
Oklahoma is currently receiving the vaccines in weekly shipments that vary in size. Last week we received 32,000 doses. Next week we'll bring in 38,000 doses. Rory Taylor, the Oklahoma News Report.